So what we've done as a pilot recently, actually, we tried to, pilot a model that we know is working elsewhere out of research. We've seen it's working. The youth-friendly corner model, where we have spaces at the health centers where these young people can come, access information. We stock those youth-friendly corners with IEC materials, but age-appropriate IEC materials. Health centers or health facilities have reported that this is actually improving the way young people access information. So we do not discriminate our young people. When the girls come, we support them. When the boys are there, we support them. We've had engagements where we've recently engaged parents in Eastern Uganda. Most parents, teachers, health workers, we've engaged them in trainings and meetings and dialogues to ensure that we are actually bridging the intergenerational gap between the parents, the teachers, all the caregivers had here. One of the biggest challenges we discussed was that parents have deviated from their role. So how do we bring them back on board? We've engaged so we feel like if there are opportunities, like when we have trainings, we do not say these are boys, we're not going to train them. Like recently we've been training young people in Eastern Uganda. Only like they can use it as a money-making venture. They can use it to support their sisters because these people are living in the same communities. We also have a value of commitment. When we say we are going to do something, we do it. When we say we are going to enhance city management in Mbale, I think they will testify. We are one of those organizations that are very compliant when it comes to accounting for what we've done and what we've not done. We share them with our budgets, we share them with our work plans, and we share them with our achievements, such that to continue talking about Mbale. Today, this is, for us, it's an advocacy meeting, and we have objectives. And one of our objectives is to meaningfully engage. Like, for example, recently we had an argument in one of our meetings where young people are saying, we cannot access certain services because we review, when we go to the health facilities, we review some of the registers and we're like, okay, why were there only boys? Why was there only this age group? Why not this one? And some of the age groups report they cannot access some of the services that they're supposed to get because they're mandated to go with a parent. Some of them maybe, we are Ugandans. I know in Uganda we pretend a lot, by the way. We are pretenders as a country. You'll find the elders who think the adult age in Uganda is still 18. It is still 18 legally, yes. But our young children, as young as 13, 14, are doing things that 30 years old people are supposed to be doing. So if a young person of 14 or 15 catches an infection, you're not expecting them to go back to the parent and say, oh, mommy, I slept with a boy, please let me go with you and I can't get it. No, they would want to get that treatment. Maybe they're feeling sick, but they're scared. They're going to engage a parent. So because we have a policy that cannot allow a 16-year-old, even a 17-year-old to go alone and access that care, they'll sit back. Maybe someone was with a partner who is HIV positive and they found out. But because they are not guided, no one is taking them there, they cannot go and get the PEP. So they will sit back and they will die. The disease will eat them up. Because a parent has to accompany them and these young people are scared. So in some of our intergenerational meetings, we've been telling the parents, please, be friendly, talk to your children. They are making mistakes. As an organization, every day we are preaching abstinence, abstain. But the rate of early pregnancies in Eastern Uganda is still alarming. In Namisindwa it's steady. In Manafa it's worse. In Bulambuli it's bad. Now, Whereas we are saying the right age for a young person to access family planning is 18. What happens to a young person who has conceived at 13 and given birth? Okay, they have given birth and still no family planning, because even when you give birth, you're still a child, right? You are still not allowed to get family planning because you are a child. So it means by the time this child reaches 19, I am 40 today, I have 3. But I'm telling you, I find a kid of 22 with more kids than me, and I'm like, how do we work when we are having a category of people that cannot access information, that cannot access care, and that cannot support themselves?
We commend you, the stakeholders, but also that some of those few policies that are not working for young people, especially the marginalized. And of course, in there, the marginalized, we also focus on key population because they are less privileged when it comes to service delivery. Let's work together to draft actionable recommendations that can inform policy reforms moving forward. Of course, in Uganda, when you talk of rights, it brings issues. But these are facts we need to talk about. Because if we keep hiding, that is why we are leaving our young people to go through all these challenges.
In the last meeting, we agreed on a few recommendations, for example, nationwide dissemination of information on policies that support the young people, the rollout or review of the framework, and then justice for young people. I know that justice for the young people is such a challenging thing, and we need to work together with the Ministry of Justice and then the Justice for Children coordinators at the local government level for us to be able to deal with some of these issues.
I will take this opportunity to invite you to our National Adolescent Health Working Group, which sits monthly. And that working group also brings together the line ministries of education, gender. Where are other partners in this? I expected jealousy to be in this room. Angela talked about local government. Something to do with partners working on issues around water. We need to bring each and everyone on board on this matter. I also commit, we are going to share with you these policies, but before that, please come to us and share with us what you're doing.
On the issues that have been also raised, I would like to urge you to take advantage of the existing structures. Angela talked about orientation of the teachers, that is very critical, but also we have guidelines on strengthening school clubs, where it is peer-led. Peer-to-peer-led approach is really very critical in ensuring that the right information is cascading through.
Information to know that as we review the framework, we also coming up with a curriculum for its implementation. We realize that we have so many content and also different materials that have been developed by the partners. So as we conclude the framework and it will be launched in October, we shall also have a curriculum now to roll it out. And if some people want to train teachers, we shall have a uniform standardized package on health and life skills. That's now a good opportunity now for this framework. So if we have NGOs that want to implement, maybe reach out to ECP, reach out to primary or secondary. We shall have now a curriculum that we are going to be able to use to deliver issues of reproductive health, life skills, and HIV across the board.
And who need also services. So what do? Anyway, as Hope Mbale, we also have values that guide us. Just as the Minister of Education put it, that they have values and they promote values. We also have values and really promote those values. But then those values should also help us to holistically look at these things. Because you will minimize a certain category and you think you're helping the community when actually you're just worsening. So it would be good that we also look at these things holistically as we also look at values, promote values. Now, one of our values is non-discrimination. So if like an MSM comes with issues, shall we not help? Shall we not intervene? If they come and report issues of that require legal, shall we not link? Shall we not, issues of GBV, they are happening and they cut across. So shall we say now the laws are there and now for us, we are not handling? As enabling partners, we get into a very compromising situation that you don't know now what to do to help actually the government do its mandate. Like Betty put it, Betty said, we pretend sometimes that these things are not there, these things are not happening, when actually they are. They are happening. The key population in Uganda, they are facing and they have unique SRHR needs. But then if we do not speak up, then who will speak for them, and also how will the government know? How will you ministry officials know that actually these things are happening? There are people who are different from the rest. So we need to, as we look at values, we need also to look at that, the non-discrimination value also.